And for our next video is a campaign ad from Nick on the topic of healthcare.
Hello, I'm Nicholas Hike, and I'm representing Jill Stein, presidential candidate for the Green Party. And the issue I'm going to talk about today is healthcare. Do you think Medicare should be amended to include a voucher system for healthcare? Under this plan, the federal government would provide seniors a subsidy to shop for insurance plans from a menu of competing private plans and traditional Medicare. Jill Stein disagrees with this voucher system, and she says we need to implement a publicly administered nonprofit system with no premiums, no deductibles, no co-pays, and no co-insurance. This eliminates the inefficiencies of private insurance corporations and provides effective cost controls. Romney agrees with this voucher system, but unfortunately, this would raise the cost for most seniors who decide to stay with traditional Medicare. Due to a study done by Kaiser Family Foundation, more than one-half of the seniors who stay with traditional Medicare will have their premiums raised $720 annually. Romney's healthcare plan provides stripped-down plans which are fairly expensive unless you are in very low income. His plan covers the very poor, but the near poor, the middle class, are about 70% covered, when you're paying approximately 10% of your income for the coverage. So this is not affordable. These middle-income Americans are not fully covered, and 40% of the people in Massachusetts, you know how Romney's always talking about what he did in Massachusetts? Well, 40% of the people in Massachusetts who need health insurance claim it's too expensive for them. And 1/4 of the people who seek payments got denied by their private insurers. Another example of evidence is that people who live in Massachusetts that get sick now go into medical bankruptcy just as they did before Romney implemented Romney Care. Essentially, 75% of the money we spend through Romney Care is for people who get sick. So we need to focus on the health of our nation. We need to use this money that we'd spend on curing these sick people to support the new Green Deal, which will create the infrastructure for real health with a local sustainable food system with fresh food and public and active transportation that allows you to get exercise on your way to school, and with clean renewable energy that effectively provides pollution prevention. Another way Jill Stein plans on cutting healthcare costs is buying medication in bulk in order to avoid overcharging for medication for citizens, which Romney's plan will eventually lead to overcharging for citizens. Let's get Americans healthy in order to stop wasting money on sick care. Let's go green, get healthy, save money.
Okay, well that wraps up this campaign ad.